Insanity is doing the same thing over and over again and expecting different results. But if you're ready to level up your life and get results that truly matter in your health, business, mindset, and relationships, then this is the podcast for you. Welcome to Scheer Madness, where we have unscripted, real conversations with the world's top athletes, entrepreneurs, and coaches. Discover real-world and tactical advice from the best in the business. Let's go. Hello, everyone, and welcome back to another episode of Scheer Madness. Today, I have on the show Dr. John Kim. He is a leader in functional medicine, and he has been a foremost voice in health, wellness, and preventative medicine. He received his doctorate in pharmacy from Rutgers University with high honors and trained in functional medicine from the American Academy of Anti-Aging Medicine. He actively lectures throughout the country and is an influencer within the functional medicine world to educate and empower everyday people to live a healthy, fulfilling life. His message is Doctor of the Future is you, the patient. Dr. Kim, I'm super excited to have you come on the show today. Thank you for being here.
Rachel, thank you so much. It's an honor to be on your podcast.
Yeah, and I'm so fascinated by your story because I find it so interesting that you were a pharmacist that went into functional medicine. And I really want to kind of dive into that before we dive into the nit and the gritty of what everything you do with functional medicine. But how did you go from wanting to become a pharmacist, getting into the world of, prescription medications to wanting to go more of the functional root cause approach?
Well, pharmacist has always been my passion since I started college. And the reason I got into pharmacy was to become a compounding pharmacist. So any audience out there not knowing what a compounding pharmacist do is basically making drugs in a lab in the pharmacy itself. So we customize medication to the patient's needs and really details in dealing with some of the niche practices in dealing with pain management, bioidentical hormone replacement therapy, in dealing with pediatrics because pediatric patients deal with special dosing that's required that's not really readily available by the manufacturer. So compounding pharmacy is there to really make things really helpful for patients to take it. That was basically my passion that I wanted to get into. And what really led me was that when I was doing my externship, my 6th year of my pharmacy school, I was in the ER and I had this particular patient that came into the ER every week with an uncontrolled high blood pressure. And at that point in time, before getting into that particular rotation, we had done extensive amount of, didactic work in dealing with some of the standard blood pressure treatment that was JNC7 at that point in time. That was back in 2006. And the first recommendation that we end up having to make for patients is that we have to make the lifestyle changes, right? But that's never discussed within ER or even just the patient care in general. And I thought that was a big disconnect. But another issue was that this patient came in every week for the 5-week rotation that I was in. So I was like, this cannot be happening. Like, this is not what I was taught. And never alone, not a fulfilling aspect of it, because you talk about the same crap over and over again. You got to optimize your medication. You got to change your diet. Maybe, potentially losing weight could end up having to lower your blood pressure at the same time. I'm questioning the doctor probably mentioned it, but the patient's not getting it. So there's that particular disconnect that really led me to, I need to find better answers and really looking at how do I impact patients' life in a greater way rather than optimizing medications. Because when I was graduating, the whole term called pharmaceutical care was something that's always been drilled into my head. But that really talked about how to optimize a patient's medication rather than optimizing that patient's life, preventative care, even in terms of dealing with overall stress and everything else that could end up having to be counseled on, but never done that way because we're so busy just dispensing medication or counting pills for that matter that pharmacists do. So that wasn't really a fulfilling portion that I ended up having to look for different answers. And I had good mentors that led me to go into doing a fellowship in anti-aging and functional medicine. That just opened up a doorway in terms of what I wanted to do in terms of the change that I wanted to create, but really happened to be that just came to be, meeting different patients and learning from those cases, as well as really getting to learn all the practices as well and just what they're doing. So in terms of 15 years of functional medicine I've done, my practice have heavily evolved from just looking at nutritional testing or optimizing hormones, now to really looking at how to change the person's dynamic inside and out by even incorporating breath work, mental health aspect that we have to really treat, and as well as look at the overall root cause issue. I think the functional medicine, we look at just the nutritional testing and really optimizing on that, even gut function that's really needed as well. But you got to look at the root cause. It could be some other pathogens, toxins, etc., that could be leading into that. So that's where I am right now.
Yeah, I find that so fascinating that you've had both experiences, though, that you've had the experience with, being more on that Western medicine side, but having that feeling of like, I feel like there's more that I could be doing. And we really get into this line of work to help people heal, to help them get to the root cause of their health issues. But when we're realizing in the process, like just by the same person coming in time after time again, they're really not getting better. There has to be more to this approach. And I know very oftentimes doctors will mention, hey, you need to lose a little bit of weight. That'll help with your blood pressure. But the person really doesn't understand, like, what does that really look like? And what is maybe inhibiting me from getting the results that I want? And very rarely do I hear, physicians even talk about things like breath work, meditation, trauma, healing, that avenue, which is why I was so drawn to a lot of the work that you do, because I think that is such a crucial part of the entire healing process that I know we're going to dive into a little bit more today. And for most of my listeners, they know a pretty good amount between the difference of Western medicine and functional medicine. As you said, functional medicine is more of addressing that root cause of what caused maybe that high blood pressure to begin with. Was it poor diet, lack of exercise, or was there other things that, we definitely picked up as well too? You've mentioned things like toxins, infections quite a bit that can very often be overlooked. And now we're addressing the why instead of necessarily just the what, which the what would be like the high blood pressure, the gut symptoms that you're experiencing overall. So we know the difference between the Western medicine and the functional medicine, or at least a lot of my listeners do with the line of work that I'm in. But some things I've really heard you talk about, even with the world of functional medicine, is more so the difference between just prescribing a bunch of supplements and super extensive testing, but really, really diving more into that person's history or their trauma, their stressors. And I know you and I talked a little bit yesterday, and I shared a bit about my own story and dealing with gut issues as I was a bikini competitor, super type A, perfectionistic. And it's so funny, I end up getting that exact type of clients who come to me, which is amazing. But I'm now able to really look at what they're coming to me for, which are these gut issues and these symptoms, but see the bigger picture, that there's more of this emotional side, there's more of this trauma side. And I'm a big believer that the whole person must heal for the gut to function optimally. It even goes far beyond sometimes just diet or just supplementation. So what is your approach look like when it comes to functional medicine? Because I loved what you were telling me a little bit about it when we got a chance to connect earlier.
Yeah. So in terms of what you had gone through and what I had to gone through, that really makes us special in the sense that we have the overall relationship that we already have with the particular, maybe the illness or something like that we couldn't have to relate to a lot of our clients and even patients. That gives them such a hope that, I've been in your shoes, but I'm actually here now, and these are the groundwork that I have laid. I'm a proof of that particular things that I've done successfully, that I'm willing to coach you. That's really a good sense of a hope that we end up having to deliver for every client that we end up to meet. So I say that a negative thing in our life is such a blessing that we have to take in a different sense of it. So that's how I approach in patients' care these days, that you know what, I have to have a lot more empathy, a lot more sensitive in terms of listening to the particular patient issue, but also really diving in and really asking the right questions for that matter, and looking at, what kind of childhood they have grown up in, or what kind of food that they have, culture as well. Culture is the biggest aspect that we have to also talk about at the same time, because if you think about American diet, that's a culture, right? In terms of the fast food and all the things that we end up having to be culturally familiar with in the United States, that doesn't keep us healthy at all. Like for instance, I'm a Korean American. I grew up in Korea until I was 9 years old, and to this day, some of the little tidbits of health tips that my grandparents gave me in terms of just think about going to a sauna, for instance. That's a regular activity that my grandfather and I did on a weekly basis. And as was taking cold bath. Now the whole agenda in terms of going into a sauna and then going to a ice bath. I mean, that's a popular thing these days that people are picking up. But the thing is, that was like really ingrained in me to do that, including like certain diets, like eating fermented food, eating clean food that matter. That was some of the things that was really embedded into it. So I think culture is really important aspect as well. That's why I want to ask, what kind of food are you eating? What kind of diet were you having growing up, right? If the person actually has been eating McDonald's the entire life and having gut issues, well, we got to look at that aspect of it. Maybe we want to talk about detox issues. Maybe we want to talk about leaky gut. You can't talk about leaky gut when you actually have a toxin getting present, and as well as particular pathogens like lipoprotein saccharides. So all these things are coming into play. So we have to systematically set up questionnaires and looking at a bigger picture instead of like honing in that, oh, you know what? This is one issue. I'm going to give one supplement and then let's get you out the door. Because that's still somewhat familiar with the allopathic medicine side that, one pill is going to fix everything. Well, it doesn't. So that's where I end up having to build up my overall practice and style that I end up having to approach for patients.
I find it interesting that you mentioned that culture piece, because I think even with today's culture, it's very, fast, instant results when it comes to everything, especially food. We want food, fast delivery, instant. We don't want to have to do the work to prepare the food. So food's going to be a lot more processed there. But I even tend to think of just the culture in terms of the pressure like we put on ourselves, especially with social media now, where everybody's showcasing their amazing lives online, and it's just like do more, be more, like this high pace, fast culture. And I think the rate of burnout is also ever so high, even too, with our culture. And everything really does come down to, what we're idolizing in a lot of different areas. And that's coming from, early on with childhood, I think, for a lot of people, and the pressures putting on of everything has to go online, social media, achievements. I know for myself, that was a big part of that entire healing process. Like I mentioned, it was really releasing a lot of that pressure, because my nervous system was just constantly in the state of fight or flight, anticipating that next thing. And I even see it with clients who come to work with me now. I was with a client here just yesterday, and it was like, what supplements do I need to take? Tell me what I can do to fix this as fast as possible. And it's really, really difficult in that type of setting, because they want to heal so bad. And I totally get that. But the mindset revolving around it of just tell me what supplements I need to take, quick and easy, fast and instant results, I think is also on the opposite spectrum, kind of slowing us down from fully being able to heal. So I find it very fascinating that you bring culture into it, because I haven't really heard that mentioned, in the world of functional medicine before. Ultimately, for a lot of people too, in the world of functional medicine, you've mentioned too, just like that laundry list of prescriptions, or not prescription, supplementation that ends up being offered with super extensive lab testing. What do you feel like a lot of functional medicine practitioners are missing in the line of work that they're doing right now?
It's looking at a bigger picture. I think we're just so familiar with overall didactic lectures that they were trained in, and not having enough clinical experience that they end up having to miss the bigger picture than anything else, right? Just give you an example. For instance, a patient comes in with an issue with low vitamin D level. This is a particular case that I worked on, and something that's been mixed by a lot of practitioners, that even though the patient might be supplemented with 5 to 10,000 units of vitamin D, it was not going up at all. But then when that's the particular issue, you got to ask the right question in terms of why is that person not able to get their 25 hydroxy level increase? Is it a gut issue? Yeah, could be. But the second matter is, do they have a particular genetic SNP issue where they're not able to ingest vitamin D level? That could be another possibility as well, because I just soon found out that for me, I can't adequately get a high amount of vitamin D level in me by ingesting it, that I have to be outside in the sun exposure. So I jokingly say that I'm an emotional houseplant, basically, that I need to be outside and getting sun exposure. Like, people are different in that sense of that. The biggest thing that this particular patient that couldn't get their vitamin D level increase was because she had a history of mold exposure. She lived in a moldy apartment when she was living in London. And then that was 7 years ago. Afterwards, she had several other bouts of issues, including now fibromyalgia that developed. And then she has a trigger of Lyme disease. And so, yeah, vitamin D level is going to be low, but that vitamin D being low is a symptom, or at least the end results of the pathogen and the root cause issue that already caused it. So it does not make any difference in terms of how much vitamin D you're going to be end up having to increase. Matter of fact, it would end up having to cause a immunosuppressive issue if you end up having to give additional vitamin D when you cannot even absorb it or utilize it or even converting it properly, right? So these are the things that really have to look in a bigger picture instead of throwing a random pill at the person, because that's what I used to do. I had a patient came in, and I'm looking back like about 10 years ago, I had a similar case with a patient who actually had mold exposure. And I thought, you get out of that particular house, it's moldy, and you're able to clear it out because your immune system is able to. But now looking back, that was a huge mistake I made. I should have looked at a little more, getting the right questions, and as well as utilizing different things like binders and able to help with the detox pathway to get rid of that and getting to the root cause issue. So that just, we learn a lot from our patients.
Yeah, for sure. And even mentioning just like low vitamin D, especially if she had a lot of mold in her system, you can imagine probably what other systems were affecting besides just her ability to absorb and utilize vitamin D in the body, especially what mold can definitely do to your gut, your mental health, your body's inflammatory response quite a bit as well too. So I agree with you with looking at the entire picture. I know with the testing that I do, one of the areas I like to start working on first is gut health, kind of given my experience, and just like the gut is connected with every system in the entire body. Is there any certain areas with your patients you tend to look at or work on first when somebody comes to see you?
First thing I end up having to ask is, what kind of food are you eating? That's the best thing that I end up having to do, because a lot of times the patients that I see is that they've done other testing before, and then now they're just coming to a functional medicine pharmacist to get a different point of view. So I just basically look at their old labs and looking at these things, and I was like, how's your diet? And the diet sometimes never mentioned or not fixed at all, or patient knows about it, but then they don't actually incorporate into that. So that's the foremost I end up having to do. And then based on what other clinical pictures I see, I would probably do other leaky gut testing to see any other sensitivities or any other pathogens that could be playing into effect, as well as certain medication that the patient might be taking that could also cause other nutritional, but also mitochondrial dysfunction that's be causing that as well. So it's a different ways in terms of doing it. I think everybody has a different ways in terms of doing approaching a patient's case. I'm just going in that route because of the overall experience that I had, and as well as for myself. I think I mentioned to you yesterday that I actually had a heart attack when I was 33 years old, and I was fit as can be, had a perfect labs, which I thought, and I found out after the heart attack and doing extensive blood work, I had a positive Bartonella infection, including mold, Epstein-Barr, and mycoplasma pneumoniae. That was a hitting factor that caused endothelial lining damage in the blood vessel to have atherosclerotic plaque getting built up, resulting in a heart attack. I had an 85% blockage in one of my arteries. So that was a life-changing moment. And as I was looking at that aspect, it is what I had to gone through, that, you know what, pathogens, toxins, even stress, all those things come into play into a person's cardiovascular system, gut problem, because I had severe gut issues at that point in time too. I had sensitive to everything, including rice and beef for that matter. So I had to be away from those particular food for 6 months and incorporating some of the like partially modified ketogenic diet to actually help to calm my immune system. But things like that end up having to really impact me in terms of looking at a bigger picture rather than, oh, you know what, this is just the one supplement thing that I could just throw at the patient that's going to fix it. Or thinking that if I give them a certain probiotic, that wouldn't have to fix a lot of the IBS issues. Because a lot of times probiotic doesn't do crap when you actually have a particular pathogens or other leaky gut issues that you may have to utilize, immunoglobulins or spore form of the probiotic. And looking at it much different ways. But you know what? My understanding was very limited. But from going through my own personal journey of healing and process, that I have a better appreciation of looking at patients' cases differently and approaching it in a much broader way, basically.
Yeah, I can definitely relate to that with your own journey. As you said, of figuring out you had all of these infections that probably wouldn't otherwise have been looked at, that played a role in your heart attack that you ended up having overall. So I also love that you mentioned the nutrition side of everything, of course. Being a dietitian myself, that's one of the first areas that we look at with everybody is getting their diet in a good place, doing an anti-inflammatory diet, looking at the lab testings thereafter for any kind of potential root causes that could be coming back with them overall. I was surprised even myself when I ran a toxin panel on myself, how much was really even in there, because I was, I'm at the point where I've healed my gut. I don't really have issues except for like the normal stuff every now and then that everybody experiences.
Everybody has that. Yeah.
But it wasn't until I ran that panel, I was like, oh my gosh, there is so much in everybody. And you even think about someone who's relatively healthy, like I'm incredibly fit. I've been healing a lot of my gut issues. I'm a dietitian, and I put so much into my health and the stress side of everything. But still coming back with all of that, you almost kind of think, I wonder what people who are actually suffer with a lot of mental health issues, chronic gut issues, all of these other different symptoms, how toxic their body may really actually be. So it's really interesting about how your own journey has allowed you to look a little bit more extensively, because I can definitely relate to that. And I think it's so important to be able to relate to your patients on a greater level. I know as I've continued to do the work on myself and grow in my healing journey, it's also added to the coaching that I get to do with my clients. And one area I'm so passionate about right now is really the trauma side and that stress side of everything. Because for me, it started off of, okay, just get your diet right and get that in a good place. Great place to start. We got to start there. And then went into, I'm going to do all of this extensive lab testing. I'm going to look at my microbiome. I'm going to look at bacteria, which was already so much more in depth than what I was getting with traditional Western medicine, because I did all the scans, the MRIs, the CT scans. They slapped a label on me of, here you have irritable bowel syndrome. And I was given just a bunch of medications to manage that, and even a suggestion to remove my entire large intestine because of how biotic my gut got. Yeah, it was so bad. And the motility actually came to a complete halt, where I couldn't use the restroom without doing like enemas or things like that anymore. Like my body's natural ability to just eliminate, not so sexy, I know, but that was the truth of it. It became that severe, and that one colorectal surgeon said, hey, this is probably something that you've had for most of your life, you're probably born with, but you go to somebody whose their job is to cut, they're going to always give you a solution to cut. But that was really my rock bottom for me, very similar to you with like having your heart attack and wanting to go down a different route in terms of healing and addressing the root cause. For me, I was like, there's got to be something more to this. And that's what led me down to learning so much about gut bacteria and the microbiome that really at the time wasn't talked about very much. I had a ton of leaky gut, dysbiosis, SIBO, my thyroid, my hormones were plummeted. And part of it, yes, was a little bit dietary related. My diet was full of artificial sweeteners, diet foods that we consider to be quote unquote calorie friendly, but not necessarily gut friendly. But really the biggest thing was the physical and emotional stress for me. Which is where at the beginning I said the whole person has to heal for that gut to function optimally, because it wasn't until I really dove into that work that everything started to click. And I know it's the same thing for my clients too. It's not like you said, one probiotic, which is like a drop in the ocean that you're going to take, that's going to fix all of these massive gut issues that have been brought on by, constant go, fight or flight mode, or you have a ton of infections, mold, gut pathogens, leaky gut. That's not really going to do a whole lot. Yes, maybe in combination with a couple of other different things, which is where you said looking at the whole picture is really so essential. But my journey has really evolved more into that healing side of what you mentioned at the beginning of breath work and meditation, and really getting my clients to look into that area. And I know one thing you even mentioned yesterday as we were talking was really that heart brain coherence, and really even being somewhat of a spiritual guide on this journey too with people. What role do you feel like that plays, or what does that even mean probably to start with, but like the heart brain connection, that coherence, and how does that really play a role in the body's ability to heal?
Sure. Let's talk about our gut, for instance. Our gut makes 90% of our serotonin. And that particular production of serotonin is actually determined by our own microbiota. So there's a lot of key plays in terms of what you eat, how you think, right? How you interact with your environment would end up having to really affect the little buggers in your gut to make the proper level of serotonin, right? So when you actually have a person who actually have mental health issues, especially depression, or even anxiety for that matter, they already have a disrupted, basically dysbiosis, another word, that's causing a lot of issues. So yes, you have to look at the aspect in dealing with the gut function. Now, we could fix that. We could get the proper diet online, and then having to calm a lot of the inflammation that's already present. But the overall caveat is the underlying problem, which is how you end up having to perceive your overall environment, and also physical stress and emotional stress that's going to be coming into that effect. Trauma is a big issue. I've seen patients dealing with trauma aspect of it, going into other issues related to like fibromyalgia and dealing with IBS or some type of digestive problems as well. So all these are biggest important thing that you have to look at. So what is breath work? Breath work is what we are already doing. We're breathing in and out. The problem is that we are forgetting how to breathe properly through our nose and then properly exhaling out through the mouth. A lot of people that I have to see, even clients that I see in the pharmacy, is that they're predominantly mouth breathers. So there's not enough oxygen to carbon dioxide exchange, resulted in higher acidity level and causing this particular chemical imbalance already that's going on and adding additional stress. So when a patient that walks in, just give you an example, what I usually do is patient walks in, they have a sleeping problem or even having anxiety issues. Yeah, I could pick up a bottle of CBD and then give it to them and say, hey, you know what, try this for a second. But instead, after getting all their information, to let them feel how proper breathing feels like, I actually coach them to breathe properly for 5 to 10 minutes before they go. And one of the reactions that I see usually is that the demeanor completely changes afterwards. Their face is a lot more relaxed. They're smiling. Another thing that patient might be saying is like, oh my God, I feel really dizzy. Yeah, you're going to feel dizzy because you haven't breathing, you have been, getting that proper oxygen the entire time. Right. So those are things that end up having to really come into play. And then the most recent thing that I just learned about is called heart math breathing. So our heart in itself has its own intelligence that it actually has, and intuition as well. So just give an example of how we feel about a particular person in front of us, or particular feeling that we might have in our heart, that issue. Sometimes you could call it a gut feeling, right? But it could be coming from our own heart that, you know what, the heart's own intelligence is telling us that we should probably like this person, we should enjoy this particular activity, or maybe not, right? But there's such a disconnect because we've been such in a go mode that we forget to listen to the internal dialogue that's already going in us. And the biggest thing that we have to really look at is how do we reflect inside, and as well as having that particular coherency between our other brain, which is our brain up here, up in our head. So I practice something called heart coherent breathing, where our overall heart rate rhythm is actually coherent to our brain to allow us to relax, allow us to think clearly in a better way. It also helps us to give a better intuition to overall decisions that we have to sometimes make, right? I think there's, I don't know if you heard of Dr. Joe Dispenza. He does a lot of, right? He does a lot of these particular things. Well, he does more in that sense of that. And he has particular machines and things to measure these things. There's a huge scientific things that you end up having to look at. Well, we could do that at home. We may not have the fancy machines. I mean, I have a heart math device that I strapped onto my ear and check on a daily basis. You don't have to spend $200 on this machine. You could barely do that at home. So I coach that aspect to our patients that having even simple autoimmune issues, that, you know what, you need to calm your nerves down in order for it to heal. And one of the things that we sometimes even mention is that this is a grounding work. You need to be grounded. You're up here. You need to be grounded. Let's get the solid foundation first. And that solid foundation deals with proper sleeping, proper management of stress, proper pooping, right? Gut function. Also dealing with the overall environment. So you need to have a clean environment, dealing with, maybe you have toxins at home you got to deal with, even toxic people you got to deal with, right? So all those things come into play. And then having to utilize, and a breathing aspect is another component that I add in. They need to breathe properly in order for you to be energized. And this is the missing part that we end up having to not mention about in functional medicine, because we're so busy testing people rather than really looking at what's the root cause issue. That root cause is, if you look at a tree, that root is not going to be shown. You got to dig in. Same aspect of it here as well. And another analogy I end up to give is that if you have a tree branch that's already dying, just because you end up having to cut the tree branch down does not mean that other tree branches will be affected. So you got to look at the overall root cause. Is it a termite? Is it a particular infection that went on the tree, for that matter? Or I don't know. So these are things that I end up having to give a simpler analogy, because I see that simplicity is the ultimate sophistication, for that matter, for people to really understand this, that, you know what, it is not a hard grasp of a concept they have to get, but simplicity in terms of looking at a bigger way that, you know what, I could make those changes readily if I choose so.
Yeah. And sometimes the simple things like breath, sunlight, doing the things that can really allow us to create that presence, getting out from here and getting into our body is really the most healing thing we can do. And sometimes we think it has to be, like you said, that laundry list of supplements, and you can spend a ton of money doing that, or we can, do some supplements, but also really do a lot of the other work, which, hey, you'll save a lot of money because air is free. We can work a little bit on our breath work. I've been diving into some more like the Wim Hof type breaths myself, which is more of like that rapid breath with breath holds, followed on the in, and then like a release. And it's literally like a full body orgasm is the only way to explain it to
you. Get tingling sensation everywhere, right?
Yeah. You get full tingling sensation. You get high on your own supply in a lot of ways, but like leaving that breathwork session, which mine will be is, short as 10 minutes long, has become so crucial for really part of my healing process, especially for, someone whose nervous system is just kind of prone to be in that, go place. That's like my innate instinctual place, as with a lot of us. And I think the power of the breath is so crucial with grounding that, because sometimes there are things that are harder to control that are very much autopilot, right? When we have a lot of those traumas, our body just responds by immediately putting us in that fight or flight state. It's not always a logical choice. It's like a body response that we're getting. But our breath, although it is something that, we don't think about and just kind of happens throughout the day, we then, by focusing on it, can control a lot of that breath, and we can slow it down, we can speed it up. And that's how we can really change a lot of our nervous system. As you've mentioned, like the heart coherence type breath, is that more of like a slower type breath, or is that more of like probably not so much like the rapid breaths like I'm talking about?
It's not.
Yeah.
So it's very simple. 5 seconds inhale through your nose, 5 seconds exhale through your mouth, and then you want to focus on your heart. So when I tell patients that when you're breathing in, just imagine that your heart is actually inflating. And then when you exhale out, your heart is deflating. But one of the caveat to this entire thing is that you want to think about what's making you happy, what's making you joyful. Because we forget about what's bringing us really joy, right? Because we're so busy working or having to deal with some of the family stress or even money or something on that line. But just think about what's bringing us happy. Right. For me, it's that I'm a born again Christian. And in terms of the overall grace that Christ gave me is something that I end up having to think about when I'm actually doing breath work. Right. And you could literally measure how much of a heart rate variability changes that occurs based on what I'm thinking. Right. Because you're creating something new by your thoughts, right? By your heart as well, being connected. And so not pushing religion or anything else, but it's just a regular, simple physiological change based on how you think and how you perceive the overall environment. And that's through breath work. And it's a simple thing that we could do. It's obviously it's free, simple thing. And to just think about whatever happiness they end up having to come through. And it could be very helpful for people out there potentially dealing with PTSD or anxiety issues, or even just to worry about something. Maybe just think about some happy childhood. I had a patient who was doing her breath work, and she was, her happy thought was about her first moment that she laid eyes on her first child, right? The moment of delivery and just having to grab onto her son. That was the first moment that she had a lot of these joy that she had. So that was one particular thing that she actually used to ground down and having to control an autonomous nervous system. I had another client where he was thinking about his overall childhood he had with his grandfather, right? So everybody's happiness is different. You got to tap into your overall insight and figure out what brings you joy, right? Maybe it could be your next step of success that you want to project into. And it really goes into Dr. Joe's work in terms of looking at, creating your own future. Well, you're already living in it, right? You're also creating your own healing as well. That's the reason why I'm a strong believer that the doctor of the future is you, not even just about controlling overall health aspect in terms of getting the care that you need because your doctor's not able to provide that, but even just to creating that healing inside is based on your choice as well.
Yeah, and we're really just the guide, but it comes down to the patients, the clients, to really do the work and to go all in on their healing for sure. I've been doing actually Dr. Joe Dispenza's meditations for many years now, and I started at the peak of COVID. And one of the things I love that he talks about is most of us are really just being run by an old program, right? We're being run by our old traumas, stressors, our old autopilot every single day, focusing on our negative thoughts. And the best example I can give is when you think of something sexual, right? The body responds in a certain way, right? And that's probably the easiest analogy for people to understand. But the very same thing happens when we go back into, an anxiety place of everything that we have to get done, do more, anticipation, or things that have happened in the past. That's typically where most of us go every single day. And the body then also responds in a very, very similar way with our nervous system. And that blunts our body's ability to heal, or it just creates a very similar outcome that we've always gotten. So in order to create a new outcome, new healing, we really have to be able to get into a place where, like you said, we have more joy, we have peace, we have excitement, we have a lot of those things. intertwined, not only in just the breath work, but in our day, which is where even on with one of my clients yesterday, one of her homework assignments was to do something that gives her joy. And I asked her immediately, what brings you joy? Where do you feel the most fulfilled? And she said, when she gets things done. And I'm like, okay, I get that 100%. But let's just say you got everything done that you needed to today. What would you do that would bring you joy? And she said she would get outside in the sun with her daughter. And I said, all right, so that is going to be something we're going to start with. What about it was just 5 minutes every single day for her getting outside, getting in that sunlight, not only the power of the sun and what that can do for our mental health, but experiencing that small amount of joy, whether it's through breath work, thinking about it, because the body doesn't know the difference between if it's real, if it's an actual act of what we're doing in the moment, or we're literally just thinking about it. But that entire process is so healing for the entire body, and especially if you're somebody who's dealing with chronic health issues. So I think that's an incredible point. So I'm hearing you talk a lot about identifying the root cause, looking at the bigger picture. I've heard you mention guarding your mind and your soul and really looking at this from a spiritual journey. The last area I really want to dive into that I've heard you talk about, which I'm incredibly fascinated about, is more on the psychedelic side of everything.
Oh, just okay.
Yeah, we're gonna go there. I haven't had many people come on my podcast talk about that, but it is something that I think a lot of people, there's a label put on it. There's a lot of fear associated with it, but I think it also can be a really cool part of the healing journey. And you've done some work with some different psychedelics in your own patients, correct?
The extent that we actually do at our pharmacy uses ketamine. So anytime the patient actually might be dealing with bipolar disorder and even including suicide ideation and severe anxiety issues, they may require a little bit of reset. I'm not saying that you go for lobotomy in terms of what they used to do back in the day, but utilizing ketamine can be very helpful. So there are in certain areas they have a medically run ketamine clinics where you go in for overnight, and you have to do it overnight. You get an infusion of ketamine, and you literally pass out for hours, about 6 to 8 hours. And then once you wake up, people feeling much more refreshed. Overall symptoms that they had to deal with from anxiety, including the suicide ideation that patient might be dealing with, that's completely gone usually. And in terms of the symptoms dealing with bipolar disorder, also been subsided as well. So, at first you end up thinking about ketamine as like, oh, special K, that's abusive drug, or it could be something that's been utilized as a horse tranquilizer, right? But the thing is, if you use it properly, there are best ways to treat sometimes the overall treatment of depression that's been resistant to some of the regular therapies. So I believe that it is a good tools to utilize. And in terms of working with a compounding pharmacies like ours, is that we're able to give you, or at least compound ketamine tablets that are rapid dissolving that you could end up having to ingest at home. So once you are stable with a particular infusion of ketamine, you could get a prescription for a rapid dissolving ketamine from a compounding pharmacy that you could take it at the comfort of your home. And you could take, between like 200 to 300 milligrams at a time. And that all depends on the patient. And then after that, you just pass out, sleep, get a good sleep, and then you feel much more refreshed. And so I've had patients who do it about 3 to 5 times a week. And then they end up having to sometimes go for a ketamine infusion once a month just to, get that going. And so I'm not a big fan of stigmatizing anything else. There's such a big stigma into utilizing cannabis as well, right? And if you look at the entire history of cannabis, for example, there is a United States pharmacopoeia. So any chemicals that compounding pharmacies like ours end up having to utilize, there's basically a stamp basically that, hey, this is safe and this is approved by the FDA, approved by a governing body of pharmacy to utilize for compounding. But did you know that there is a USP pharmacopoeia monograph for cannabis extracts? That was basically printed back in the late 1800s. So there were companies like Eli Lilly, Pfizer for that matter, even Wyeth, McKesson, all these drug companies are still in business. Well, they were in the business of making cannabis extract back in the day. I didn't know about that until I went to Barcelona back in 2019. I think that was the last international trip I basically took. And there was a cannabis museum there. I walked in and I was looking around, I'm like, holy crap, there's a bottle of these cannabis extracts that were made in the United States. So it was already approved for that use. And there were many indications for that matter. But the problem was there was such a negative stigma that came through because of prohibition, but also in dealing with racism as well. At that point in time, it wasn't called the DEA, but that other particular name was governing the controlled substance, including alcohol. But the head of that particular unit basically came out stating that cannabis had to be controlled because it's utilized by Blacks, Hispanics, and Filipinos, and they're going to go after white women. So there's basically a lot of racism being driven into that particular thing, and that was a negative stigma that went on. And then the entire hippie culture back in the 60s and 70s, right, use of cannabis ended up having to increase. Well, there was another effort that the government started to try to silence as well. So there's a lot of stigma because of that reason, but there is a place and time utilizing cannabis for medicine purposes as long as it's properly and safely done. But one of the key points I would like to at least make is that there's no cases of overdosing on cannabis, right? You could overdose on ketamine, but not cannabis. Neither will you overdose on psychedelic mushrooms, right? And I've had patients where they use psilocybin or the magic mushroom, if you want to call it, shrooms, to help with that anxiety and depression issue as well, because utilization of psilocybins, for that matter, the active compound there, it actually helps to increase a BDNF, so brain-derived neurotrophic factor, to increase memory, also helps with PTSD issues, also act as increasing neuroplasticity. So your overall creativity level increases because of that. And when you're also dealing with potential trauma, for that matter, that issue that was causing anxiety, well, it's going to still stay, but you're not thinking about it anymore because that's beyond the passing of that. And so that's another useful ways in terms of utilize these things. So I did make a video on my Instagram talking about it. I had a naturopathic physician, Dr. Britz, and she actually really specialized in tapering patients off of pharmaceutical anxiety medications and antidepressants. And there's a big role in doing that. But she was not a big fan of utilizing different modes of this particular matter in terms of dealing with anxiety. But you know what? I'm open to it. I'm not going to be dispensing it in my pharmacy for that matter. But if the patients are able to have ways to access that, if it's helping you, you do you. That's one thing that needs to be really opened up, because the amount of people that are suffering from mental health has exponentially increased since the start of the pandemic, right? Even including suicide. Why can't we save those lives, right? Why can't we make an improvement those people, right? And then get rid of the overall stigma and then help them where it's really needed, right? There's a whole thing about utilizing safe needle policy to shoot up heroin. Was that helping? Yeah. Right? What can we help the patients who are suffering right now and within our community could potentially end up having to, kill themselves or doing something even worse, right? Mental health is the biggest thing that we have to come into play. And there's a huge component of spiritual aspect of it as well. I mentioned about it in my video there, because even spiritual wise, I talk about spiritual in terms of just talking about angels and devils. That's not it. Including just interact with different people. That's a lot of trauma, right? And so what you watch, what you hear, what you listen to, what kind of people you're interacting, those are all going to impact as well. And so if you're having anxiety issues from looking at the news, simple way, don't watch it. Don't listen to it, right? There are better ways to cope with your overall issue. And another thing you could add in is breath work. That's going to help you really help to reset and control what's actually happening in you to help to really get grounded and then having to have a better quality of life. That's what I'm actually promoting. I'm not promoting any use of illegal drugs or anything like that. It's just that there are different tools available that we could help patients, and we got to be open to it.
I think it's so dependent on that person and that journey, and setting is obviously going to be incredibly important too. And I think where it gets a little bit more of a negative stigma is when, people end up using it for running away from problems, masking, kind of like a vice in a lot of different ways, where that's where cannabis may have been used for people. And whatever it is that we're using, like cannabis, it'll intensify what's already there, based off of what I've seen. But I think in proper setting and really trying to utilize it in combination with everything else that we've already talked about. If you're somebody who's addressed their nutrition, who's addressed, other infections, toxins, looked into that, their gut health, is addressing the stress, is doing some of the breath work, and you still have that little bit that's left and is stubborn, because trauma, it really can stay stuck in the body. I think that's where, looking into things like ketamine, other psychedelics, psilocybin, DMT can be incredibly useful to really help get that out of the body, help give the brain a little bit of a reset, so we're not staying stuck, like you said, in a lot of those more toxic negative thoughts that is really inhibiting everybody's ability, or inhibiting that person's ability to heal. I find the research on psychedelics to be incredibly fascinating, with what it can do for people who have dealt with PTSD, trauma, anxiety, depression, and how it works so differently than, like with what you mentioned, between just standard SSRIs, anxiety medications that create a lot of dependency on it, where people struggle to get off, and you mess with their drugs later on. I know a lot of people who've ended up committing suicide because you change one little thing in their medication. Now their neurotransmitters are completely off, and that does it for them. Whereas doing a lot of this work and looking into psychedelics, that doesn't have the same kind of dependency thereafter, and it really can address a lot of the root issue of that trauma that's in the body. So I agree with you in terms of being open depending on that person and where they are at in their journey. I don't think maybe for somebody who's just getting started on their healing journey, that would probably be the first thing that you'd want to go to, nor immediately just using that as the sole source of healing. I also know people who've done psychedelics and, got away from doing any of the other work, the breath work, continuing to do the work on diving into some of their trauma, releasing that from their body. Somatic work can definitely be incredibly helpful, looking at their nutrition. And they don't really get the full benefit from it, because that is like their sole, goal is just to use that to get rid of it completely.
Right.
That really, I think, benefits the most when used in combination with everything, especially breath work. Like you mentioned, that's the best drug that we can ever take to really get a lot of that trapped energy out of the body. And that's really at the core of what it is. It's trapped energy stuck in the body that we just need to figure out a way to get out. And for a lot of us, that at least initially, that's where we end up turning towards a lot of things that maybe have a negative association with it. Vices, that's where we turn to food, that trapped energy in the body. How can I get rid of this as fast as possible? Okay, this food, for a momentary period of time, it helps me get rid of it. It distracts me. This is where I'll turn towards drugs, alcohol. For other people, it can be sex, whatever the vices may be. Everybody has vices. Social media could even be a form of a vice, something that distracts us. But I think when we can get that trapped energy out of the body through things like breath work, meditation, or even, the use of psychedelics, I think that's really the ultimate goal. So this has been incredible. I think with the whole approach of addressing the root cause, mind, body, and soul, and even for some people, looking into things like psychedelics. For those who are listening, they may be like, oh my goodness, where do I even start with any of this? What would you say are some simple steps for those who are listening that they could maybe start taking on their own? I'm assuming breath work is definitely one of those that we could throw in there.
Yeah. So, even before we end up having to touch that, one thing that we didn't touch is overall root cause issue dealing with the mental health aspect of it. And I did mention one time about Bartonella infection for that matter, the same infection that I had, end up having to incur a heart attack that could also attack the brain to cause anxiety, depression, suicide ideation, including manic depression, and then even mania. So those are things that really have to look at is if you happen to work with a functional medicine doctor and having to get those proper labs done and treating the underlying issue, that could be very helpful as well. That's also including parasites, right? Toxoplasmosis is a good example where you could end up having to get that particular parasite infection from cats. Well, that in itself can cause a lot of the mania and the overall mental health, including aggressiveness, to occur from the parasite at the same time. So your microbiome is a good thing that I end up having to readdress before, but also parasites, even mold, including other opportunist infections, can play huge issue with your mental health. And so if you are not able to get the overall relief that you're looking for, if you feel stuck, yes, we talked about psychedelics before, and that could be one good way in terms of utilizing it, right? But it's not going to fix the root cause problem, right? That's just putting a Band-Aid on it, right? So I say, just don't put a Band-Aid on it, dig deeper, and then really figure out what's happening. You got to find the right doctor. Also, I think in dealing with that, you have to also look at how your mitochondria function is also working as well. So good nutrition is one thing, but also supporting your cellular membrane is the biggest thing that you could do for your mental health, your brain health, and also entire inflammatory condition you're actually dealing with. For example, phosphocholine, which is vitally needed for our tight junction in our gut, but also in dealing with our cellular membrane, our brain, and everywhere else, that end up having to be a gateway between what's coming in and out of your cell. The problem is that when you're dealing with a chronic infection or even toxins, your mitochondria end up having to cause a blockade of these toxins from getting out. And so what's going to happen is you're going to entrap all that toxins in. And so it doesn't make a difference what kind of supplement you're doing. You're not going to get any better until you get to that issue, dealing with the cellular membrane, getting that thing out. So that's where the PC therapy or phosphocholine is so vital here, along with utilizing bioactive oil. So if listeners out there, if you could utilize like supplements like a Body Bio, they make a great liposomal phosphocholine along with a bioactive oil that actually helps to detox, get your cellular membrane back in order, support your mitochondria. It will also help your brain and your mental health as well. So that's really needed at the same time. And the biggest issue that I see sometimes is that, not trying to bash on vegans, is that vegans tend to lack on these type of phospholipids like PCs and the bioactive oils because of the limitation of the diet that they're dealing with.
We get a lot of those from egg yolk, like choline, phosphatidylcholine.
Yeah.
Missing a lot in the traditional no meat vegan-based diet. Yeah.
So that's why whenever you're dealing with mental health, you got to eat properly as well. And that could be hard as well because you're already depressed. You don't want to have food anyway. But just coming to effect that in order for you to tackle the root cause issue dealing with the mental health, that you're going to have to look in a bigger picture into nutritional. Phosphocholine could be one thing that you need to really add in. Eat properly, go out, get the proper sun exposure you're going to be needing. You're going to make you feel better as well. But in terms of you're answering your question, in terms of particularly getting that psychedelics, I don't have a real good recommendation. The reason being is the legality aspect in dealing with psychedelics, especially psilocybins, are varying from state to state, even country to country for that matter. I know California, even Oregon, just legalized it, so you could probably get it through there. But there are small companies right now that are really trying to, finagle through the legal process in different states. So hopefully that is available pretty soon. In utilizing ketamine for that matter, you got to have to get a referral from your doctor to work with a ketamine clinic to get that done, and including working with a compounding pharmacist like myself to get a compounded ketamine rapid dissolving tablet so you could take it home, right? Another thing that you could potentially use, and I didn't get a chance to even mention this, is that there's an old drug called naltrexone. And naltrexone's been used for opiate withdrawal and as well as alcohol withdrawal. The thing is that when you're using microdoses of it, doses between like zero 0.5 to 4.5, it can actually work with your own body's endorphin system to help deal with the trauma as well as mental health issue as well. So we do utilize that for patients in conjunction with ketamine sometimes. And so that's something that you could discuss with your doctor. And any patients out there needing much more information, they could obviously reach out to me as well. So that's one of the options as well. In dealing with microdosing LSD, I don't know any places that are legalizing that yet, so I cannot promote that at all. I know there are certain publicly traded companies right now that are really looking into microdosing LSD, and hopefully that gets approved by the FDA soon than later to get these things out and utilize in a control clinic, right? But it's progressing, and I hope people out there who are suffering right now, they still have a little bit of hope to get certain different answers, and then getting the relief they're looking for.
Yeah, I think the really big thing here is like there is so many different avenues to go down beyond what we're traditionally taught with Western medicine, or what the approaches are. We're just so used to, we've mentioned so many different things on this podcast that people can dive into. But I'd say, like, if you're listening to this, definitely finding a good functional medicine practitioner who you feel like you can really relate with, understand your story is going to be crucial, to get the proper testing, to look for things like mold toxicity, other infections, looking at your gut microbiome, your nutrition, and potentially exploring other different options. But I think having someone as a guide is so crucial, especially if you're somebody who is severely depressed, dealing with anxiety, depression, or even any other type of, health issues, gut issues, autoimmune conditions. I mean, they all are going to need more of this root cause based approach. So I love that functional medicine is becoming such more well known, but I do think, it still is going to require more than just the testing and the supplementation approach, which is why I wanted to bring you on, because there's so much more that goes into it here. But for those who are listening, things you can definitely start with, start with addressing your diet, and removing inflammatory foods from your diet, focusing on more gut healing foods, healthy fats, mono, polyunsaturated fats, honestly, eating real whole food, probably the simplest approach to start with. That is going to be the least complicated, comes in a bag or a box, has a long list of ingredients. We should probably avoid it. But eating just real whole food is one of the most healing things we can do for a body. Getting sunlight, focusing on breath. I mean, just starting with those few things can already change somebody's mental health state exponentially. And if you start with that and you want to seek help additionally, I'd say that's when it's a great time to reach out to a functional medicine practitioner who can really help guide you along what may be the best approach for you overall. So Dr. Kim, this has been incredible having you on my show today. I could continue to ask you more and more questions, so I'll have to definitely have you come back on at some point in time. But where can people find you online and learn more about what you do?
Absolutely. Rachel, thank you so much for this opportunity. And for listeners out there that want to reach out to me on my own website, drkimwellness.com. You can reach out to me there, and as well as reach out to me through Instagram. It's dr.john.pharmd, what a PHARMD as in dog there.
All right, guys, we'll put all of that in the show notes here today. Definitely go check out Dr. Kim. And if you enjoyed today's podcast, please pay it forward and share this on your social media story. And don't forget to tag at drjohn.pharmd. I probably messed that up, but definitely check it out in the show notes.
It's a mouthful. It's a mouthful.
As well as myself at Rachel Scheer. And Dr. Kim, it's been a pleasure to have me on my show here today. And you guys, this has been Scheer Madness.